arterial health, and so if we could give them a few minutes to talk to us, that'd be great.
Good morning, everybody. Thanks for coming by. I know you. Thanks for having me here today. We want to take some time and talk to you a little bit about peripheral vascular disease and how it can affect you. And then during the talk, after the talk, we'll be doing some screening ultrasounds and taking a look at your arteries and see what they look like. By way of introduction, I'm a vascular surgeon. I've been practicing in Orange County for about 10 years. And my practice encompasses the entire gamut of arterial and venous problems. So let's have some conversations. The vascular system is comprised of your arteries and your veins. The arteries carry blood away from the heart out to the rest of the body, and the veins carry them back. The arteries and veins can have different sorts of problems, and we'll talk a little bit about what those types of problems can be and how they affect you. Vascular disease is particularly common. It affects lots and lots of folks, and it's been sort of undertreated, we would say, over the past 20, 30 years. We've got new techniques and new tricks and ways that we can make folks feel better and live better, and so that's why I wanted to talk to you today. There are a few common risk factors for peripheral arterial disease, in particular, blockage of the arteries. Folks who smoke are at higher risk, and with our public health efforts over the past 30, 40 years, that population's dropping. Unfortunately, having smoked in the past for a while does increase your risk of these sorts of problems later in life. Folks with high blood pressure also tend to get arterial problems. The high blood pressure itself stresses out the arteries and causes changes which can lead to blockages and other issues. Hardening of the arteries is atherosclerosis. Folks with diabetes can also have an increased risk of these sorts of issues, in addition to the other problems that go along with diabetes. High cholesterol, which is why your primary care doctors are always checking cholesterol and starting you on cholesterol medications, can lead to these issues. And lastly, nobody's calling anybody old here, but this is a disease of advancing age. Here we've got just sort of a little schematic. You can see a nice, clean, healthy artery on the left with its 3 layers, and then cholesterol plaque disease starts to build up on the inside of the artery, restricting blood flow past that area and can even shut the artery completely down. Peripheral arterial disease affects a few main distributions. There's the carotid arteries, which come up from the chest, up across the neck, and lead into the brain. Aneurysms, which are when instead of an artery plugging up, it degenerates, starts to fall apart, and expands like a tire with a bubble in it. And then there's also leg occlusive disease, or blockages down in the leg. We'll talk about each of these in a little bit more detail. So as I mentioned, carotid disease is blockages or narrowing of the arteries that lead to the brain. The carotid arteries come off really close to the heart, span across the neck. There's a front one that goes to your face, which is not important from a blood flow perspective, and then a back one that leads up to the brain, which is responsible for blood flow to about the front 2/3 of your brain. Now, unfortunately, that area of that division point, just above the halfway up the neck, is a very common location to get cholesterol plaque disease. And what can happen as the area gets more and more narrow, the blood has to move faster and faster past it. Think if you're canoeing down a stream, it gets narrow, you move quicker. Well, as that blood flow moves quicker and quicker, it can break off a bit of that cholesterol plaque and shoot it up into the brain. If it's a really small piece, or it goes somewhere unimportant, or somewhere where there's a bunch of other arteries to help out, you might never notice. If that bit of junk is a bit bigger, it goes somewhere more sensitive, you have a mini stroke, what's called a TIA. Folks talk about, I was reading the paper and then boom, my arm just dropped. 5 minutes, 30 minutes, an hour later, it came back. That's a really significant warning sign, and every now and then, unfortunately, I still, in this day, hear about folks who say, you know, it happened 4 or 5 times, I didn't care about it, and then they had a bigger problem. So if you ever develop an issue like that, you should head straight to the emergency room. Other things that can be affected include the leg, less commonly than the arm. Also, if that bit of junk shoots out to the eye, folks will describe sort of their visioning in one eye tunneling out like the end of a Bugs Bunny cartoon, or as if a window shade dropped down and then came back. Lastly, there's also affecting the speech area. Folks will say, I was talking, and all of a sudden I couldn't make any words. I was still thinking, but everything mouth-wise, speech-wise stopped working. If the bit of junk that shoots off from that area is bigger, it goes to somewhere more sensitive where there aren't as many arteries nearby to help out, those changes can become permanent. Permanent in the stroke world means more than 24 hours. So that's called a stroke. Folks lose the ability to use an arm, a leg, half the body, vision in one eye, etc. Carotid disease causes about 40 to 50% of all the strokes that occur in the United States every year. And it's something that you're going to get screened for today if you elect to participate. Treatment involves an operation, more so than the minimally invasive techniques that we are trying to do in a lot of other things. But it's a 3-hour operation. It's one night in the hospital. Folks are out and about, back to full activity a day later. So that's one of our points we'd like to stress, that it's easy to fix and can prevent a devastating problem. Aneurysms are a little bit different in that we're not talking about blockage of an artery, but rather an artery expanding and wearing out. Arteries are pulsatile, meaning that they feel the full effect of the heartbeat as they're carrying blood away out to the body. And as a way of converting the two-stroke pump output of the heart, which is either on or off, by having the arteries be stretchy, in between heartbeats, the arteries can sort of relax back and keep the blood moving forward. So the way they do that is they have a stretchy fiber or a protein in their walls called elastin, and elastin is elastic. It stretches with each heartbeat. Well, just like if you were to take a rubber band and leave it out on the windowsill in the sunlight for a couple weeks, then go to stretch it, it might not stretch back, it might even crack or break. Your elastin can wear out. The risk factors for this are the same as the risk factors for peripheral arterial disease, high blood pressure, smoking, high cholesterol, etc. And with aneurysms, we want to catch them before they pop. The most common location outside the brain to have an aneurysm is in the belly, just above where the gigantic artery that swings out of the heart splits into two. Just above that split area is where the aorta can grow and potentially pop. Based on studies that were done back in the 40s and 50s when we were able to image aortas but couldn't really fix them very well, unfortunately, we know at about what size that becomes an issue, and therefore it's appropriate to keep an eye out for that and to treat it before it becomes a problem. Beginning about 10 years ago, screening for aneurysms was approved for folks over a certain age or with a certain family history or with a smoking history. And we'll try and take a look today. It won't be a full study, but it would be reasonable if you choose to undergo the screening, just to look to see if you have an aneurysm. Treatment of aneurysms used to involve gigantic operations, opening you up from stem to stern, a week in the hospital, etc. But these days, over 85–90% of aneurysms can be fixed with small incisions down in the arteries in the legs. I use those as an on-ramp to the three-way system that is your aorta and arteries. And we put devices in from the inside, sort of like patching a tire instead of replacing it. Folks go home after one night in the hospital. Lower extremity arterial disease is kind of one of the primary focuses of my practice because I feel like it's undertreated. There are particular locations in the leg where the arteries are subject to more stress and therefore more cholesterol plaque disease, particularly just above the knee and a couple other places. Up to 40% of folks who have these issues don't have any problems, so it's a little bit, it makes sense to see somebody who actually thinks about things instead of sees something and wants to jump on it and fix it. But that means that about the other 60% do have issues. Most of those folks complain about pain in the legs when they walk. They get a certain distance and the calf cramps up. They have to stop and rest before they can get going again. However, if that gets worse and worse and worse, and thankfully the risk of that is low, but it does happen, folks can develop what we call rest pain or pain in the foot in the middle of the night. Patients will describe to me that they go to bed around 9:30, 10 o'clock. They wake up at around 11 o'clock or midnight. Front of the foot really hurts. It feels like it's been dunked in ice. They have to sit up, hang the leg down over the bed, etc. That really means that the leg's not getting enough blood flow, and it's something that needs to be addressed. Folks can also develop wounds or infections due to diabetes as well as the peripheral arterial disease out on the front of the foot. And a big part of my work in working on lower extremity arterial occlusive disease is preventing amputations. And so if folks do develop a wound, generally they get seen at a wound healing center, and then I will try and do my best to get the blood flow better. I like to tell folks that healing a wound is a lot like growing a garden. If you don't get the water there, the blood, the nutrients, and so on, you're not going to be able to heal very well. Lastly, a problem that's not related to your arteries, but rather your veins that I thought we could talk about just a little bit since it is far more common, is varicose veins. Varicose veins occur when the valves in the veins have failed. The veins need valves in them because, unlike the arteries, the veins are a low pressure system, and yet they're responsible for carrying blood from the legs back up to the heart. So they got a series of one-way check valves in them. Every time you take a step, shift side to side, and move around, the muscles push in and around the veins and force the blood up. In between those bursts of activity, gravity pulls the blood back down and the valves should snap shut. In about 20-25% of folks, more often than women because of the whole pregnancy thing and so on, one or more of those valves can collapse. When the valve collapses, the next valve in the chain, which is about an inch or two away, has to do double duty. Oftentimes it can't, and so on and so on. You end up with a situation where you've got wrong way flow in the veins heading from higher in the leg to lower in the leg. That can cause the veins to stretch out, distend. They push against the nerves, they cause discomfort. Left untreated, and if there's enough other issues as well, that can even lead to wounds where the veins sort of eat through the skin and the skin falls apart. For those sorts of things, there's new minimally invasive treatments we've been doing for about 10 years that we can do to make folks feel better. That's about all I had planned to say. For those of you who signed up for the screening, we'll get that done for you. I'm not going anywhere. I'll hang out. I'll be happy to answer any questions.
We're looking for the, I said, oh, here it is.
So we have a question right here, Dr.
I'm so
Yes.
sorry.
Where's the screening taking place?
I'm sorry,
Where's the screening taking place?
about 12 feet down the hall.
Oh, it's gonna
Flower
be
Yeah.
for Mr. Bean is going to take some pictures.
The wine.
Yeah.
when?
I know, after
Oh.
he's done answering any questions.
All right.
I just have to find your form.
Yes, sir.
Well,
So I'm with Barry Matt,